Many of us have heard or have used dihydroergotamine, DHE. In fact, this drug has been around for more than 70 years and it has proven efficacy. We use it to break a cycle of migraine, or we'll use it when other treatments have failed. Because unlike other oral medications, dihydroergotamine has had a profile that hits multiple receptors. It's a molecule that is versatile. It has been used in the IV, in subcutaneous, as well as intramuscular formulations. In particular, when patients need freedom of pain without a treatment window, IV DHE provides that relief. The trouble with DHE at home has been an inconsistent absorption, particularly with traditional nasal sprays. In September of 2021, Trudhesa got approved. Trudhesa uses the same liquid formulation of dihydroergotamine, but uses a proprietary delivery system called POD, or Precision Olfactory Delivery System, that targets the upper nasal space. The so what from this delivery system is that you don't get wastage of drug either into the oral cavity or as a drip in front of the nose. The studies that were done to get Trudhesa through regulatory approval were predominantly safety studies. In these studies, the primary endpoints were to look at nasal safety. Patients who had cardiovascular risk factors were also included, and we found no new treatment emergent adverse events as it relates to cardiovascular disease, such as changes in blood pressure, pulse, or EKG changes. The most common adverse events that were reported in the STOP 301 study for Trudhesa were local, which included nasopharyngitis at 21% and rhinitis at 19%. Although these were not pre-specified, we also did some exploratory efficacy endpoints from the Trudhesa safety study. We have been able to demonstrate that the location of the delivery can make a difference. 38% of patients reported freedom from pain at 2 hours from their first attack that they treated with Trudhesa. With regards to most bothersome symptom, that rate was 52%. Further, the relief was felt as early as 15 minutes, and 66% of patients reported pain relief at 2 hours. So when you're considering your armamentarium, there are patients who can certainly use a more broad spectrum approach. We also have to remember that there is a dysfunction in the gut-brain interaction, particularly for patients with migraine, and a non-oral route that is consistently delivered becomes very, very important.
Indication and important safety information. Indication. Trudhesa is an ergotamine derivative indicated for the acute treatment of migraine with or without aura in adults. Warning: peripheral ischemia following co-administration with potent CYP3A4 inhibitors. Serious and/or life-threatening peripheral ischemia has been associated with the co-administration of dihydroergotamine with strong CYP3A4 inhibitors. Because CYP3A4 inhibition elevates the serum levels of dihydroergotamine, the risk for vasospasm leading to cerebral ischemia and/or ischemia of the extremities is increased. Hence, concomitant use of Trudhesa with strong CYP3A4 inhibitors is contraindicated. Limitations of use. Trudhesa is not indicated for the preventive treatment of migraine or for the management of hemiplegic or basilar migraine. Contraindications. Trudhesa is not recommended in patients with concomitant use of strong CYP3A4 inhibitors, such as protease inhibitors, for example, ritonavir, nelfinavir, or indinavir, and macrolide antibiotics, for example erythromycin or clarithromycin, ischemic heart disease or coronary artery vasospasm, uncontrolled hypertension, known peripheral arterial diseases, sepsis, following vascular surgery, or severe hepatic or renal impairment, hypersensitivity to ergot alkaloids, concomitant use of other 5-HT1 agonists, for example, sumatriptan, or ergotamine-containing or ergot-type medications within 24 hours, concomitant use of peripheral and central vasoconstrictors. Warnings and precautions. Trudhesa may cause cardiac events in patients with risk factors of coronary artery diseases. Consider administration of the first dose of Trudhesa under medical supervision, including the use of an electrocardiogram. Cerebrovascular events. Cerebrovascular events, for example, cerebral hemorrhage, subarachnoid hemorrhage, and stroke, have been reported, particularly with dihydroergotamine mesylate injection. Vasospasm, elevated blood pressure. Dihydroergotamine may cause vasospasm or elevation in blood pressure. Fibrotic complications. Rare cases have been reported following prolonged daily use of dihydroergotamine mesylate. Administration of Trudhesa should not exceed the dosing guidelines or be used for chronic daily administration. Medication overuse headache. Detoxification may be necessary. Preterm labor. Advise pregnant women of the risk. Local irritation. Local irritation has been reported following administration of Trudhesa. Most common adverse reactions. Most common adverse reactions, incidence greater than 1%, were rhinitis, nausea, altered sense of taste, application site reactions, dizziness, vomiting, somnolence, pharyngitis, and diarrhea. Use in special populations. Pregnancy. Available data from published literature indicate an increased risk of preterm delivery with Trudhesa use during pregnancy. Lactation. Patients should not breastfeed during treatment with Trudhesa and for 3 days after the last dose. Please see the Trudhesa full prescribing information, including boxed warning and medication guide. The risk information provided here is not comprehensive. The FDA-approved product labeling can be found at www.trudhesahcp.com or 1-800-555-DRUG. You can also call 1-833-TRUDHESA, 1-833-878-3437 for additional information.